Good afternoon, and welcome to On Becoming Innovative, From the Bleeding Edge to the Beginners, a webinar tweet chat combo from Health Systems CIO, produced in collaboration with CHIME. Just a little housekeeping before we get started. My name is Anthony Guerra. I'm the Editor-in-Chief of Health Systems CIO, and I will be your moderator today. We are having a simultaneous tweet chat hosted by Kate Gamble, our Managing Editor and Director of Social Media. You can participate in a separate browser or on your phone by using the hashtag HSCIOchat, or you can simply view the tweet chat in the Media Viewer panel on the right-hand side of your screen. We'll also be using the Q&A panel today, so if you have a question as you're listening to the discussion, type it in, send it in, and leave the default set to all panelists, and we will take those later in the program. And you can download the deck by using the URL on your screen. Just so you see how we're going to spend our time today, we're going to go about 35 to 40 minutes with our featured panel discussion featuring Cara Babachicos, SVP and CIO at South Shore Health System, Myra Davis, SVP and CIO at Texas Children's Hospital, and Jonathan Fritz, Executive Director of CHIME Innovation. So without further delay, we're going to jump right in. Cara, let's start with you. Can you give us an overview of your organization and role?
So my organization is 10 miles south of Boston. It's a health system that basically I'm in charge of biomed, all of the applications, as well as just starting to get involved in the innovation perspective. So at the start of the year, I kicked off in the innovation role as well.
Okay, and what do you have an additional title or not really?
Not right now. It's kind of, even for all the other things I'm taking on, it's just still considered the CIO role.
Okay, very good. We'll talk more about that too. Myra.
Yeah, so I am the CIO here, and our organization we are located in Houston, Texas. We have 4 hospitals. We have a health plan, and we have quite a few primary care practices across the greater Houston area, as well as urgent care. And bed-wise capacity, we're about 800 beds from a capacity standpoint. From a CIO structure standpoint, I'm the system CIO across the technology across all gamuts. Recently acquired Biomed, and in the last 3 months acquired the title of Chief Information Innovation Officer. That's a mouthful, but that has a separate structure that consists of a planning and data analytics team, as well as a business process re-engineering team, and that's most recent.
Okay, very good. So also Biomed. So it sounds like all the CIOs are getting Biomed. Myra, do you think that's the case? Is it something that's going on?
I think at some point it's going to happen. The convergence is needed just because of the lines are getting blurred in terms of the medical devices and tethering to the network, and the data that's needed out of it to feed into the EMR for analytic purposes or outcomes purpose. So it's just a matter of time.
Right. Very good. Okay, Jonathan.
Yes, I lead innovation for CHIME, which I would expect many of the folks on the call to know what CHIME is, but briefly, we're a membership organization that's about 27 years old. We've got more than 3,000 members across 55 countries and growing. We've been expanding quite a bit internationally lately. Chapters in India, Israel, Canada, UK, Ireland, Germany, and others. Largely a relationship organization. I know that Myra and Cara have been very active in CHIME over the years. And I joined CHIME full-time in January to develop, create, and build an innovation initiative for CHIME. Really a passion of mine. Come from a little bit of a different background in that I'm a recovering patent attorney and startup business lawyer, practiced for more than 12 years, and I'm also a angel investor and venture investor in startups and guide those types of organizations on an ongoing basis.
Very good. All right. Thank you, Jonathan. I think a good place to start is with a definition because, as I say here, if you get 10 CIOs to define innovation, you might have 10 different definitions. So let's start with you, Myra. What's your definition of innovation?
It's funny you asked that because as I mentioned, I recently inherited the word innovation in my title, and when it was announced, it was really telling. The congratulatory emails that were coming ranged from it was amazing how they perceived my role to be. So I thought, well, I'm going to go out and get a definition of innovation from the organization. What does innovation mean? And really, at the end of the day, there's the noun version of innovation, which is inherent in your title, but then there's the actual verb of innovation, which is an action that you want the organization to take, which is around how do you think about the world innovatively and how do you change. And the root of the word innovation means to change. And so I personally think there's an inherent behavior that we seek from an organization, particularly in healthcare as it's changing, that the mindset must change to think about ways of doing work differently, which speaks to innovation. And then there's the innovative role of how do you enable solutions, albeit whether it's solutions of technology or solutions of influencing changes in workflows or operations to accept the technology that's being introduced. And I sometimes classify that as a little I. And then there's always the big, I, that's the fun of commercialization of products, creation of medical devices, et cetera. But then along the spectrum, there's the practice of whether it's machine learning or robotics or blockchain, et cetera. All of that is innovation, but how you choose to leverage it, you have to influence a change in operations and a change in competency of the people that will be working with certain technologies. So it's a long way of defining it, but I think that it's much more broadly, and it's around how do you change in terms whether it's technology or whether it's operations or whether it's people.
It's very interesting. I appreciate that answer. It's not simple. This is not a simple thing to even define. So, and I think that's why it's a worthwhile and interesting discussion, because you've got folks on the line, folks out there that want to or need to be innovative and really may not even be able to figure out what that means. Like, where do I start? And that's what we're going to talk about. So, but John, let's go to you. Your thoughts on what Myra said and your definition of what it means to be innovative. Yeah, go ahead.
Sure. I take a little bit more of a broad approach and picture of innovation. And I think of innovation as a creative solution to a problem or opportunity that has a meaningful impact and measurable outcome. And from that, you can gather technology is not a cornerstone. It's not necessarily a piece of innovation. There's process innovation. There's business model innovation. So I think that it's helpful for us to be broadly defining it, but actually giving some parameters to it. Because, I could take the approach that innovation needs to have inventions, it needs to have technology, but I don't think that is the right approach to take. So much more of a broad definition and really about solving problems or creating solutions to opportunities. And I think a very strong element of innovation is understanding what type of progress you're trying to help your customers or your customer segment make through that effort or through those initiatives.
Yeah, and in your definition, the one word I found interesting was creative. So remember you had that word in your definition, the creative approach, right?
Yes, absolutely.
So,
I think that there's a lot of ways of solving problems, but if you're really innovative, I think there's a creative element to that.
Right. No. Okay. Very interesting. Cara, definition of innovation.
So, I mean, everything that both Myra and Jonathan said make a lot of sense and kind of a big part of how I define innovation as well. But some of the additional things that I would also suggest is it's not just, in my mind, it's not just a creative idea. It's about coming with an idea that you can then put into operations and have, to the point made earlier, measurable outcomes or an impact. There is a huge part of it that's change management. And so while someone can think of very innovative ideas, if you can't actually do something with it to actually then make it happen, it's really not, in my mind, truly innovative to think about it in kind of a non-impactful way. So the KPIs, making sure it's measurable, making sure we understand the business plan, how we know if we're successful at the end of the day, and then what is it you're doing, what's the change that's actually happening, and how do you get people kind of motivated around kind of trying the new idea and maybe even experimenting in that space. So while you can be very creative, if we're creative, but then we can't put it and channel it into something productive. I find that that's often part of the challenge with truly being innovative is taking the idea and then, again, making it operational. Okay,
that makes sense. Myra, I want to ask you something. So we talked about creative, unusual, different, things like that. So you've got that in your title now. Can you possibly imagine looking at an issue and going to solve a problem? We look at checklists, right? One of the most magical, wonderful things ever applied to doing things better, right? Airlines, healthcare, checklist. Is a checklist innovative, but it's effective? So could you be in a position where you're coming up with solutions, improving processes, but it's not, quote unquote, innovative?
I don't think so. I think because of how I'm defining it, I think we can always be in a position where we're asking ourselves to think about things differently and creatively that are measurable. And so I would say yes. I can always be in a position of influencing the conversation to think about doing something different when presented with a problem.
Okay. Cara, any thoughts there around, if you focus on improving things, that's one thing. If you're focused on being innovative, that maybe you may be setting a higher bar maybe than you need to. Does that make any sense?
Well, I mean, when you're trying to improve something, first of all, why are you trying to improve it, right? So you're improving it because either it's broken or there's pain points or there's an idea out there that there's a more efficient way of doing it. If I take something that's already been done by others and it's pretty mainstream, I guess would we call that innovative if all of a sudden my organization adopted something that was, let's say pretty standard way of doing business? Probably not. It would be allowing us to be more open-minded and, kind of look for process improvement. But truly innovative would be someone who's been following the same steps every day in a checklist, or a new set of eyes coming in and saying, well, why are we doing step 2 and 3 on the checklist? Why don't we actually reverse the order and maybe trying that if you reverse the order, you have a more productive outcome, or kind of looking at doing things differently than how you've done it before. That's truly, I guess, how I would get really particular about defining innovation. It's maybe just looking at things with a new set of eyes and looking at being creative in terms of what might be the outcomes or a new way to achieve that, better outcomes.
Okay, very good. Jonathan, any thoughts on this sort of point I'm trying to look at? Is there relevancy to to trying to decide the difference between improving, versus innovating? Can you improve without innovating? Does it even matter?
I think you bring up an interesting point along with Cara and Myra, in that much of innovation is adoption, in that it's already been done before, but maybe in a different industry or in a different context. And I do believe that it is creative to take innovations from other industries or from other circumstances and apply them and adopt them to your particular set of circumstances or to your particular industry segment. And I think that is actually innovation, and much of what we'll see going forward is taking examples from other industries and adopting them into healthcare, especially around business models.
I think that's the point I think I agree with you, and I think that's the point I was trying to make, that there's a lot that people can do by improving what they have and looking what other people are doing, adopting best practices, and that you got to be pretty good at what you're doing to be really innovative, to then kick it up to that next notch of breaking new ground. So I think that's very interesting. All right, John, let's stick with you on this one. How do IT leaders become innovative? So you're on the line, you're listening today, you say, listen, I'm supposed to be innovative, my boss told me I better get innovative. Well, how do you start? I mean, is it something like we were saying about looking about what's going on around you and some best practices at your health systems, at other health systems, outside of healthcare? How do you start?
I think one of the first steps is to have somewhat of a gut check and understand or appreciate what innovation should mean for your particular organization. Your particular organization may not be in a position or best suited to create a venture capital fund that invests in new innovations, or create a separate group that develops new digital health innovations. And so I think first doing that kind of introspection to figure out what does innovation, or what should it look like at your organization. But I like the concept of activation energy, and thinking, what is the minimum energy that is required to put in to actually start this going. And I do believe that it's very simple to start by walking into the halls of your organization, looking at different areas, and simply observing your customer segments, looking for friction points, and then empowering your teams to solve those friction points creatively. And I think that those are some interesting areas that you don't need a lot of capital. You don't need a lot of outside investment or personnel, but to empower teams to solve problems. And I think that you can make progress for your customer segments by helping remove those friction points, whatever they are, and just getting out and observing them.
Yeah, so that's a very good point. What does it mean for my organization? So to be innovative as a CIO in a 250-bed community hospital is different than an 8-hospital health system academic medical center. So it's going to be two completely different things, right? That's what you're saying?
Absolutely.
Yeah, very good. Cara?
So I think the big part of innovation is really working with people that are in your organization that you can partner with, right? So if I basically decide I want to be innovative tomorrow and I stand up and start saying, well, we should be trying this and that, well, that's really not going to go anywhere, right? So it's trying to partner up with other people that might also have that energy, as Jonathan calls it, that activation energy, have a compelling reason to want to change something or have that creative spirit and be willing to partner with you, because as we all know as CIOs, it's that putting the technology in is usually the easier part of our job. It's getting people bought into doing it something a different way, changing people's behavior, there are winners and losers in a lot of the changes that come by, right? So how do we actually get people inspired to come forward with creative ideas, and then how do we partner with them and get small wins from the beginning? And it could help reduce pain points and show some small successes to then build on other successes. I think that's pretty successful. Also looking at where there's grant opportunities or a burning platform or something that we're trying to do, or a lot of organizations like ours are focused on substance abuse disorder and opioid challenges, and we're involved in the MIH programs, and we have an EMS service, and so we have a lot of creative ideas that we've been able to implement, but it usually takes someone who kind of comes up with the idea, partnering up with others, and then, kind of reprioritizing things that this kind of comes to the top of the list. And again, achieving small wins and then growing those wins and starting to create a credible reputation that you guys can get things done in this space, and others come forward with ideas, and, you kind of ask for proposals, or you create a council or different ways to, get the ideas fostered. At least, that's just one idea that might work.
Mm-hmm.
Works within my organization.
Very good. Myra?
Yeah, we're really similar to the way Cara described it. I think it's really creating a structure that welcomes ideas to come in where they can be fastly and explored and not have to go through a level of bureaucracy in terms of governing bodies or committees. And I think when you get some quick wins like that, it will create a pipeline of other ideas to explore. I think that's one avenue. And then the other way is just to continue to influence the behaviors of thinking differently and creatively about solving problems that you've been grappling with for quite some time in your organization. And I think that speaks to whether your organization is small or large, there's just some levels of influence that can happen with current investments to react to and respond to, but the way in which you do that, I definitely think it calls for a structure that allows you to move faster than the traditional, conventional governance structures that some organizations lend themselves to today.
Very good. All right. Thank you for that. Cara, let's go with you on this one. How can IT leaders get others around them to embrace innovation? So in this scenario, you're an innovative CIO or IT leader, but you're not feeling that sort of vibe from those around you. Any thoughts on how you can get that feeling going, get other people to sort of embrace innovation?
Yeah, I think there's different ways. First of all, you have to find someone with the energy, or someone that has some complementary energy who wants to at least think innovatively. If you have someone who's really stuck in the old way of thinking and cannot see the value in it, I really probably wouldn't put them on my close team of, trying to empower innovation through the organization. Beyond that, some of the things that we did is we actually took people off-site, and we did a little bit of a design thinking workshop, partnered up with one of the insurance companies in the area, and we did a little mini learning where we allowed others to kind of work in that space of solving like mental health challenges in the city of Boston, and we worked together and we kind of went through an exercise. And while it wasn't something that we were going to walk away with a fully baked solution that we could bring back to our organization, it helped us get a mental model for how you have to kind of be open-minded and approach things and kind of do the steps in the research process. I also have sent some of my folks, or continue to send some of my folks, off to some innovation training, and I've done some programs even prior to coming to this organization where I did a certificate program in innovation and strategy, and it was an excellent program because it gave me the opportunity to kind of go through the motions of even setting up a startup and, kind of taking an idea from incubation all the way through how you might price it, things like that. And then some people on my team have, not to do, I'm doing a shameless plug here for CHIME, but some of the CHIME innovation work that Jonathan has done, I couldn't attend one of the sessions, and I sent one of my direct reports out to one of the CHIME Innovation summits, so that he could learn and then come back and kind of be an ambassador. And we've introduced some of those tools even into some of our strategy discussions. So, and then there's books that we're reading, and there's different, YouTubes that we kind of talk about, or Harvard Business Review articles on innovation. And we're really kind of trying to do a temperature check a little bit to see who's really up for the challenge. And then I think one of the other things, and I've talked about this before in different forums, is we also did a little bit of getting people to propose their ideas and how we make that kind of fun. And I did like a little Shark Tank thing a few years ago. This is even before the innovation thing really kicked off, but how we had people who wanted their project to kind of, be considered. We kind of had people get familiar with what the idea was and champion some critical success factors or what might be a benefit, and to kind of learn to shop around ideas and to get feedback. Those are all just different ways that I've kind of seen us get a little more innovative in our thinking, rather than kind of get wedded to it's always been done this way philosophy. It also doesn't hurt that we've had a lot of change in the organization and a lot of key systems have been implemented, and we're in the midst of another ERP system implementation. So one of my mantras is never to waste a good crisis, or, kind of jump onto the energy of something that's already been started. And while that's going to be a whole change in our thinking, innovation can get employed or developed in conjunction with some of these projects as well. So it's kind of changing a lot of old behaviors and trying to find the what's in it for others, and the win-win strategy of how we might have a better outcome as a result of some of these changes.
Right. Change begets change. It creates that kind of environment, as opposed to you're working in a place where nothing's changed in a long time. It might be harder to get moving. Right.
Exactly.
Myra, thoughts?
Yeah, lots of different ways we're trying it as well. Internally in my team, we've come up with we call them the Innovate Change Empowered Team ICE, and we started it last year where we created a team of 6. 5 of the leaders on the team have worked with us less than a year, and one has worked here 5+ years. And the idea is these are people that are coming in new to the organization with lots of great ideas, and so we're looking for them to give us a different lens on how can we transform some changes that we've become comfortable with in our organization. The one person that's on the team that's been here longer is sort of not the naysayer, but the one that sort of keeps everyone balanced in terms of how do you think about it. It's also to get them uncomfortable with being uncomfortable with forcing some changes that we need to make in the organization. And we're going to switch them out this year, but I will say it's simple things like reducing the number of meetings that the teams have attended, reducing the number of attendees in our change management meetings. They've made some pretty radical recommendations, and there's been acceptance of the changes, so we're going to keep that going. The reason for that is it's one thing to say you want the organization to be innovative and think about using technology, but we did this internally to sort of change the mindset and the behaviors of our own leadership team so that they understand that change is not easy, and it speaks to culture and all of the above. So that's one avenue. The other avenue is from the PANDA and the Planning and Analytics data team. We're starting to really create sort of a portfolio of opportunities or problems that we have or challenges that we have across the organization. And we're beginning to use data to tell stories to sort of influence the need for change by leaders outside of our organization, outside of the IS organization. Something that we are focused on now is the multiple ways that it takes to schedule an intake process into our organization. It's been something that's near and dear to many of our operational leaders' hearts, so it's hard for them to see it because they've been so close to it. And so we're using coming up with an agnostic, very objective way to look at something that's real, to promote ideas, to think about how could we do it differently. And then we are also leveraging, we've had EPIC for quite some time now, 10+ years. We leverage the STARS report as a model of maturity. It's a point of reference, and it speaks to how we're not choosing to leverage technology to to advance how we practice, or whether it's operationally or clinically. And we're getting some traction on that, and it's really getting the organization intrigued in terms of what does it take to leverage this technology, what does it take on my end to be able to do it successfully. So we're looking at ways to measure the before and the after. And those are just a sample of how we're looking to create change and innovative thinking in our organization.
Excellent. Very good. All right, I want to go to the next question. I'm going to go with Jonathan on this one so we can move through some of these questions. You talked about how you don't have to be starting a fund and opening incubators, but we, in this webinar, we wanted to cover sort of getting started and also the advanced stuff. So, Jonathan, I want to put this question to you. Advanced innovation, incubators, formal programs, what are some starting points? So let's say you are an innovative organization and you're ready to take that next step and maybe formalize things a little more and do some of these other things. What's some advice for launching and running advanced programs?
I think one of them is asking the question, what is the output that's desired from these programs? Because some organizations view it different than others, in which an accelerator, incubator, Shark Tank, call it what you will, or business plan competition, they look at it from the standpoint of helping develop and create a culture of innovation, and that has the desired output or the value. Others look at it from the standpoint of associated with venture capital, whether it's a professionally managed fund that they have or it's investments off the balance sheet, and that they're looking for new ideas to align with their mission and potentially commercialize those and be revenue generators. So I really do believe that it comes down to what is the output that the desired output from these activities. Some other organizations want to use it as a marketing mechanism, and there's nothing necessarily wrong with that, to say that, look, we're part of the community, we're trying to bring in new ideas, new ways of solving problems to improve how they deliver health and care. So I think that's okay as well. The one thing I will say as far as the structure is concerned, really helping the organization get to a point of being curious. And on the individual level, I think that's a really important trait, is to have curiosity. And if you can also empower those, folks in the organization by understanding that innovation is a discipline, and there are tools and there are frameworks, that you can set up the structure and have an incubator, accelerator, or innovation contest. But when you give them these sort of tools to use, you're going to have a much greater likelihood of success. And there are many models out there that can be replicated. There's a whole host of excellent accelerators out there, like Generator and Techstars, and a whole host of others. And so you can look at those models and create some from that to kind of get started. But I do think that it's important to educate and give the information to those that would be participating and help them understand the discipline and the tools and frameworks that are out there.
All right, very good. Next question, let's go to you, Cara. How can CIOs be innovative when they may feel 100% of their time is taken up with things they absolutely have to get done? And this often comes up in the context of regulations, especially under meaningful use and things like that, and there's still things that are going on that you could say, all right, I have to do all this stuff, the government says so, and that's it. I got nothing left. I've got no time left. So what are your thoughts around that?
So one, I think, is innovation is pretty fun and interesting for me, so I have to find ways to delegate some of the other work that I'm doing, or how we partner up to make sure innovation stays kind of at the top of the list, or that we're kind of keeping it on target, that we keep bringing it up and that we're not kind of letting it fall by the wayside when things get busy. Otherwise, just to keep that energy going, I think I'll size the projects so that it's not like you necessarily have to be building a robotics lab, but what are some small things that you can start doing? And I think Jonathan made the point of creating the tools. So this is kind of one of the harder, I think the people part of, moving innovation is always the biggest challenge. I think it's always the biggest challenge in all that we do, but what I find is people have great ideas, and then when you say, all right, let's partner up, let's come up with a business plan, let's come up with some KPIs on how we measure this, a lot of times they don't know how to, or we find that they just don't have the interest in working that hard at it. Where you have to...
That takes the fun out of it.
Yeah, so you have to, but if we lead it and they're not bought into it, then it's not going to be successful. So we try to find people that can work with us as kind of to create some prototypes, to create some examples that we can point to and say, I know it wasn't huge, but here's something we started to do, and this is the first of our entree points, so that others are more comfortable bringing it forward and trying to celebrate it. We're also starting something in my organization which might not apply to everyone else, but when we look at employee engagement and recognition, we're starting a campaign that kicks off on Monday that also has innovative ideas, having people bring forward at all ranks in the organization innovative ideas and having them kind of get celebrated, and then we can even bring them up through the Innovation Council if we're really trying to put it in place in a broader scale. These could be small things that they do, small little wins, let's say even the lab does, or some of the departments do, that are very small in nature, but they can be celebrated. And how can we kind of create more energy to get others coming forward with creative ideas? So I think you have to size it. And then if you're truly really trying to drive the organization and it's a top-down thing where the CEO and others are bought into it, then they are going to have to help you fund it, right? So whether you bring in someone to help you with it, or again, you find others in your team to take on different responsibilities so that you can kind of move this forward, or even you bring in a group that might be able to help with some of the business planning, but again, not take the onus off of the business to kind of come up with the plan, but to teach them how to fish. I think those are all important things.
All right, very good. We have an audience question, and let me throw it to you, Myra. Why has the industry moved to CIOs as innovators? Do organizations have other C-suite execs as innovation officers? Would the CMO, CNO, or quality officer be just as good in this role?
The answer is yes. First of all, innovation is everyone's responsibility. So the designation of it to a title, a role like the CIO is only, in my mind, not the designation of the mindset that one person owns all innovation, because that is not realistic, nor is that's not realistic. So that translates to it could be anyone's role, the chief nursing officer, quality officer, et cetera, and it should be in everyone's role, the thinking. But the structure and the framework by which you go about innovation becomes the responsibility of the one that's designated to welcome the ideas and to ensure that the ideas are getting vetted and promoted and developed, and potentially, if they're the right type of ideas, they deliver, and they operationalize themselves. So I want to reinforce that innovative thinking is everyone's responsibility. The creation of someone taking it on is really more, in my mind, the creation of a structure that will create a structure to allow it to accelerate itself and to further promote how you go about exploring those ideas.
Very good. So, Cara, let me just take that to you for a minute. So, I've spoken to many CIOs, and I hear a lot of times that because technology folks and technology executives and CIOs are very good at operationalizing things, sort of just getting things done, they get a lot of stuff thrown at them. So, we got this thing we want to get done. It's not quite IT, but throw it to the CIO. They'll get it done because, the shops have a reputation for accomplishing things. So Myra's point that it has to be, everyone's got to be innovative, but someone has to hold the designation, but it doesn't necessarily have to be the CIO. Your thoughts around that with that dynamic in mind that CIOs are known for getting things done?
Yeah, I entirely agree. CIOs are known for getting things done. And, part of my role in the organization I'm in right now, too, is I'm now in charge of the enterprise PMO. So that's not just the IT PMO, right? So that's part of it, right? So but the point of it is, I don't have to be the one thinking of all the creative ideas. I can come up with people who have, great technical or great vendor relationships, or who are really creative researchers. They still need someone partnering with them to help take their idea and make it happen. So if I had $1 for every time someone comes to me with a great idea, or every vendor that comes to me with a great idea, that's not what it is, right? It's taking the great idea and making it real for your organization. I think what IT has the unique advantage of is we know how it all fits together, and we've kind of been in the trenches in a lot of these departments and these organizations, and we know who the decision makers are, we know what the barriers are, and we can kind of help accelerate some of these things. And we have a great team of realists who know how to get things done, and that what's really holding us back, and how you get that buy-in. So, well, I don't have to own the innovation. Someone probably has to partner up with me if I wasn't going to own it, to help make sure we could actually get to the closure point, because a lot of times it's just we have that ability to deliver,
right.
And to deliver on really complex things. And we also, I think, have, most of the CIOs I know have the ability, when you hear someone or someone comes in to explain something, you can kind of hear the elevator pitch, but say, oh, wow, okay, I know these 6 things that are going to be problems, and let's figure out if this is really, you think like that. It's just more of, kind of our background and how to make things happen. And sometimes we can be seen as the person that's causing the friction, because we'll call people out on the barriers up front because we know they exist. But once we help remove them, it's a glide path into the finish line. So, I think it's it can be other people. There are a lot of people who, want to be in this space and like to be in this space. But again, it's not it's a team sport here. It's not just one person who kind of makes it all happen. It's just how we all work together and collaborate.
Excellent. All right, Jonathan, let me go to you. I want to make sure we get this in. Tell us about some of the things CHIME Innovation is working on, and how can CIOs get involved with CHIME Innovation?
Sure. CHIME Innovation is really focused around 2 main elements, and that's education and innovation facilitation. Cara mentioned one of the workshops that we put on at our Innovation Center at Intermountain Healthcare in Salt Lake City, and that was developing an innovation framework and really teaching some of those tools and disciplines, and really giving the CIOs and other IT executives the ability to go back to their organizations and start implementing innovation. We have another workshop coming up, Innovation Strategy, Launch, and Execution. This September, we have a new event. It's the CI20 Innovation Summit. I is squared, innovation and information. And this gets to the point that you were just asking about, in that you have different roles within the organization that are being asked to own innovation. In fact, we had a recent survey of our members, and a very large number of them indicated they own innovation at their organization, but they also work in tandem or in partnership with the Chief Strategy Officer, the Chief Digital Transformation Officer, a number of different titles. But that Innovation Summit that we're going to have in September, really a curated audience of innovation and information leaders focusing around, leading the digital health ecosystem. Other ways to get involved, we have our Innovation Center at Intermountain. We have a letter of intent with Sheba Medical Center in Tel Aviv and several others that we're in discussions with within the U.S. as well as international. And members and non-members alike can get involved in being part of that ecosystem. We have a CHIME Innovation Advisory Board, a 5G committee, really focusing on the 5G or the impact that 5G will have in healthcare, as well as a number of other committees focused around different technology areas and innovation elements. And so those are, a few of the areas that folks can get involved with CHIME Innovation.
Excellent. Very good. Thank you for that. All right, Myra, I want to run this one by you. I've heard CIOs say their organizations can only absorb so much change at once. Can we overdo innovation? Can we overload our organizations if we're not careful about it?
The answer is yes, if it's not done in a structural way. But if it's done in a way that has purpose and measurable components before and after, I think it depends on the maturity of the organization and their willingness and how much they can consume. We all know it's no secret that healthcare is always and will always be a service organization, but we know because of multiple reasons, the model of healthcare must change. It's no secret that there's a lot of adoption in the model of healthcare from a technological standpoint when it comes to whether it's care coordination, whether it's population health, targeted populations, whether it's looking at solutions to begin to gamify certain diagnoses to keep patients better, whether it's access or creating a better experience for patients. All of that's been done before in other industries, and healthcare is beginning to look at what is it that they must do, we must do. And with that said, that's a lot of change that we must encounter as leaders in the organization. And I think it sort of gets to what Cara spoke to, what Jonathan's spoken to, around the framework that's needed, the influence, the education, and the promotion of ideas that's needed. And I think it depends on the appetite and the maturity of the organization's leadership to know what's the reasonable bandwidth of change that can be expected. I don't think we should put a threshold on it. It all depends.
Cara, you had mentioned all the change at your organization, and you may have, I don't know if you referred back to partners or you were just talking about South Shore, but your thoughts on this issue of overdoing it and maybe overloading the organization, is that something that folks need to look out for? Cara? Oh, you're on mute. Let me take you off.
I'm on mute?
Go.
Oh, I was on mute, Cara. Really?
Yeah, I don't know how that WebEx fun. Go ahead.
Yeah, I mean, I think to the point that we have to change, right? In healthcare, we have to change, and you have to also look at the employees in the organization and what their ability to take on that change is going to be, and if you even have the right workforce and sometimes in place, right? So there's a lot of variables that kind of play out. But just like in life, how much change can one person take on, right? So, you always have the most stressful things you see that people can take on in life, and, if you kind of get into two or three or more of those things, then you're kind of highly stressed. An organization can be highly stressed too if you don't balance it right. But the pace of change is so much more rapid than I've ever seen before. I mean, just my organization alone here at South Shore, we put an EHR in, and now we're putting a major ERP system. Those are foundational systems that impact the entire organization. And then on top of that, while we were putting our EHR in, we became an ACO, a next-gen ACO. We put in an ambulance service. We're constantly buying urgent care centers and doing things with partnerships and affiliations. So the pace, it's kind of like you have to expect to work at a different level than you've ever worked before. I think regarding the change, it's not it's not kind of a light game anymore. The pace of change is I don't think going to lessen anytime soon. But that being said, there's only so much staff, there's only so many resources, there's only so much that any one organization can do. So you kind of have to balance and prioritize what's most important. Otherwise, you're not going to do anything really well. You'll do everything maybe on your list, but nothing that will be substantial or really game changer, potentially without other risks that are going to be there. So, yeah, you can have too much change, absolutely. It's just about balancing it and then what the organization is willing to take on as the risk.
Very good. Well, we've got time for, I think, one person to ask the other panelists a question. I'm going to give that designation to Jonathan. So, Jonathan, do you have a question for Cara and or Myra?
I do. I have a question for Cara. And I have the benefit of having multiple conversations with Cara around innovation, and I thought it would be interesting to the listeners to hear some of her perspectives. But the question that I have on this is, what was your first reaction to being asked to own innovation, and what were your first steps?
I was actually excited to own innovation, and part of the first step was I guess I really tried to understand, like, kind of managing expectations around what did they really mean by innovation, because in my head, I love to think of things creatively, and I had to put together a group of people that I considered most innovative in my organization and at least bring them together. So I brought together a multidisciplinary team of people. And what was super interesting is some observers were like, you chose everyone who's only been at the organization like 2 to 3 years, which was kind of interesting because I found that in my organization there's a lot of people that had have an older way of thinking about things, and change is difficult. And so I took the people that were coming more from outside, who are hired in part by the CEO, president of my organization, is very innovative himself, and I think he respects that, and kind of looking at directionally where we're trying to move it. So I actually brought together other people that I thought would have different perspectives and asked them to think of anything that we've been doing that's innovative and get all their ideas. So I found it as just kind of what I want to be doing in my career, and hopefully I can take it to another place. But I'm also trying to moderate it and be careful, because I have a tendency to get super excited about things and try to accelerate them. So I'm trying to keep pace with the organization initially until we can stand up some really successful wins, and then once we have that portfolio, kind of build it from there. I don't know if that answers the question, or Jonathan, what you were pointing to. I'm not sure exactly.
You hit it spot on, Cara.
Oh, okay. Great.
Let's put that quickly to Myra too, because she's taking on the innovation role as well. So Myra, your thoughts when you were asked to take on innovation, and then your first moves.
Yeah, the initial thought was, what does that mean? Just being honest, and because, again, I took a position of, I think everyone in the organization should be innovative, but so we've been on a journey of sort of going through a discovery process of defining what does innovation mean for our organization specifically. And then we have talked to all the senior leaders in the organization, board members, as well as brought in frontline leaders to sort of define it for ourselves, to help us with the definition. So we took a similar approach to Cara, and now that we've done that, we're sort of in the next layer of, okay, based on this definition, what does a structure look like to support it? And the structure is where we are in terms of creation, and then we'll deliver this to the organization. And I do believe we are going to need, we don't have a formal group to go to help vet innovative ideas, to accelerate them, to explore them. And so that's becoming apparent. While we want everyone to be innovative in their thinking, we need to create a place for them to go to further vet out those ideas, and so we're focused on the structure now.
Well, that's fantastic. That's great information. It's interesting that both Cara and Myra said the first thing was, well, what's the definition? What are we talking about here? And I think that's very illustrative of what's going on. And it's important, if you want to be innovative, to figure out what that means. And if someone's asked you to be innovative or take on the role, what does that mean is a good starting point. So with that, I want to thank everyone for attending today regarding continuing education. If you hold the CHIME CIO certification, attending our webinars gets you one CEU. If you need a certificate of attendance for another CEU program, use the final slide in this deck. You'll get an email when our archive recording has been posted to our YouTube channel. If you'd like us to produce a webinar on the topic of your choice, you can contact Nancy Wilcox from our team. And you can go to our website to view our upcoming schedule. So with that, I want to thank our panel, Cara Babachicos, Myra Davis, and Jonathan Fritz. I want to thank CHIME for collaborating with us on this event, and I want to thank you for attending. And with that, everybody have a wonderful day. Thank you.
Thank you. Bye.